Number 2, please.
Hi, good morning. My name is Justin Danhof. I'm representing the National Center for Public Policy Research. I have a question about health care. When former President Obama sought assistance promoting his health care law, Walgreens actually partnered with the administration to promote ObamaCare and its exchanges. Largely unpopular, ObamaCare is now unraveling. It proved to be a failure. Premiums skyrocketed. Large insurers took massive taxpayer bailouts, and many insurers had to leave the exchanges altogether because they weren't working. In late 2013, it was also reported that Walgreens was dumping 160,000 employees from their health care plans and sending them onto private exchanges. It was reported that this was done in part because of high compliance costs based on Obamacare. So this shifted the burden of rising health insurance costs from the company to its employees. Walgreens' greatest asset is its employees, and unless their compensation will continue to increase to cover these new costs, it will have done harm to its greatest advocates. Ironically, as the face of the company, these are some of the same exact employees that the company tasked with promoting Obamacare to the consumers. But my question isn't about the past. I want to be forward-looking today. The current political climate offers a very unique chance for both private industry and healthcare consumers. President Trump has vowed to repeal and replace Obamacare, I think everyone knows that, with a more patient-centric approach that provides greater options and relies on market forces to control prices rather than a top-down government structure. So I have 2 very quick questions. You said, Mr. Skinner, to limit it to 2.
Have you asked a question yet?
Nope.
Okay. I can't tell whether you're here trumping the Trump administration or the Obama administration. I don't know what you're...
I'm juxtaposing them.
Oh, very good.
So, will Walgreens work with the Trump administration to promote its health care agenda as it did with the Obama administration? And what specific reforms would you suggest? It's kind of a blank slate right now, so you guys have a great opportunity to help advance the future of health care, and what would you suggest that look like? So will you work with them? What should it look like? And will you, in 2014, it was reported that when you dumped the employees onto the private exchange, you covered the costs for 2014. Will you continue that practice for your employees going forward to cover the costs of their health insurance? So thanks.
Thank you very much. First of all, we're going to work with any and every administration relative to providing appropriate health care for not only our employees, but for the people in the communities around America. And so whether that's the Obama administration or the Trump administration currently, it behooves us to work closely with those administrations in the implementation of whatever health care process that is being administered. And so, as you would imagine, it's a smart thing to do so that we're able to leverage our health care and our consumer and patients being able to access health care, and certainly our employees. There were a lot of questions in there that we wouldn't be able to answer right now because we don't really know what the lay of the land is going to look like in terms of any repealing of the health care law and what might be coming down the line. In the meantime, we do everything we can to make sure that our customers and our patients are served well in the healthcare administration through Walgreens Boots Alliance, and certainly, and that our patients are and employees are appropriately taken care of relative to the health care. Thank you.
So what about the employees, though, the future costs? Because you kind of shifted. That was the second question.
I think we're going to do whatever we have to make sure that they're able to afford the health care. And so thank you.